So, coming to the auditory tube we call it as Eustachian tube, or we can call it as pharyngotympanic tube. This is the auditory tube. It is a Eustachian tube which connects the anterior wall of the tympanic cavity to the lateral wall of the nasopharynx. This auditory tube, it maintains the, because of its openings into the lateral wall of the nasopharynx, it maintains the equilibrium of the air pressure on either sides of the tympanic membrane, and here also for the proper vibrations of sounds. So auditory tube or Eustachian tube or pharyngotympanic tube, it is a osseo-cartilaginous canal which communicates the anterior wall of the tympanic cavity through the lateral wall of the nasopharynx. So it is a osseo-cartilaginous canal which communicates the anterior wall of the tympanic cavity to the lateral wall of the nasopharynx. So coming to the directions of the auditory tube it is directed downwards, forwards and medially, and making an angle of 45 degrees with the sagittal plane and 30 degrees with the horizontal plane. So it directs downwards, forwards and medially, making an angle of 45 degrees with the horizontal plane and 35 degrees with the making an angle of 45 degrees with the vertical plane, sagittal plane, and 30 degrees with the horizontal plane, and it is about 38 mm in diameter, 38 mm in the length of the auditory tube. It is about 38 mm. Out of these 38 mm, 12 mm is the osseous part, and remaining 24 mm is the cartilaginous part. So the auditory tube is about 38 mm in length. Out of this 12 mm is the osseous part, and the remaining 24 mm is the cartilaginous part, and it opens into the lateral wall of the nasopharynx. Here, coming to the osseous part of the auditory tube, it starts at the anterior wall of the tympanic cavity and it turns downwards and medially, and it becomes narrower here, where it is continuous with the cartilaginous part of the auditory tube, so it becomes narrower. It starts at the anterior wall of the tympanic cavity. So this is the tympanic cavity here. Look, so this is the tympanic cavity. It starts at the anterior wall of the tympanic cavity, where it ends at the junction of squamous and petrous part of temporal bones. So at the junction of squamous and petrous part of temporal bones, it ends by narrowing, and where it continues with the cartilaginous part. So this is the bony part of the auditory tube, and this is the cartilaginous part of auditory tube. So the bony part, it is only 12 mm and the cartilaginous part is about 24 mm, double the size. Okay, so here it continues with the cartilaginous part of the auditory tube. So coming to the relations of the bony part of the auditory tube, we have tensor tympani separated by a bony canal. Tensor tympani muscle is here, tensor tympani muscle, and below and immediately we have carotid canal. So carotid canal is seen here. Look at the sky. So carotid canal is seen here. We have hole here, and this is the carotid canal. So medially we have carotid canal, and above we have tensor tympani, and below we have tympanic plate. So this is the tympanic plate here. We can see the tympanic plate here. Here is the tympanic plate. Just nearer to the mastoid process, we have tympanic plate. Below we have tympanic plate. Above we have canal for tensor tympani, and below we have tympanic plate is here, and medially we have carotid canal. And laterally we have tegment tympani. This is the petrous part of temporal bone, right? So on the laterally we have one thin bone is present. We call it as tegment tympani. Laterally we have tegment tympani. This is the tegment tympani. So those are the relations of the osseous part of auditory tube. So osseous part of auditory tube starts at the anterior end of the tympanic cavity, where it ends by narrowing at the junction of squamous and petrous part of temporal bones, where it is continuous with the cartilaginous part of auditory tube. It is about 12 mm in length. Relations: above we have canal for tensor tympani, below we have tympanic plate, and here is the tympanic plate here. And medially we have carotid canal. So we can see the carotid canal here. Medially we have carotid canal. So this is the carotid canal. Medially we have carotid canal here. Medially we have carotid canal. It is situated here. Medially we have carotid canal, and laterally we have tegment tympani, a thin plate of bone at the petrous part of temporal bone. We have a thin plate of bone. We call it as tegment tympani. So those are the relations of the osseous part of the auditory tube. And coming to the cartilaginous part of the auditory tube, the cartilaginous part of the auditory tube starts at the anterior end of the osseous part, but this part is narrower and we call it as isthmus. This part is narrower and we call this part as isthmus. The isthmus is the narrower part of the auditory tube, where the cartilaginous part of auditory tube starts from the bony part. This isthmus is the narrower part, and it runs forwards and medially, and it opens here into the lateral wall of the nasopharynx by piercing the buccopharyngeal fascia and pharyngobasilar fascia at the sinus of Morgagni. So we know that sinus of Morgagni, it is a space at the base of the skull and the upper border of superior constrictor muscle. We have a space, we call it as sinus of Morgagni, which is covered by pharyngobasilar and buccopharyngeal fascia. This auditory tube, this medial part, anteromedial part of the auditory tube, it pierces the sinus of Morgagni and opens into the lateral wall of nasopharynx. On the lateral wall of nasopharynx, it is guarded by a tubal elevation, right? It is guarded by a tubal elevation where the tubal tonsils are present over the tubal elevation. From here, the tubal elevation, we know that two folds extend. They are called the salpingo-palatine fold and salpingo-pharyngeal fold. So it opens into the lateral valley by piercing the buccopharyngeal fascia and also pharyngobasilar fascia before opening into the lateral wall of the nasopharynx, and it is guarded by tubal elevation. It consists of tubal tonsil. So that is the anteromedial opening of the cartilaginous part. So the cartilaginous part starts at the anterior end of the osseous part, where it is narrower and it makes an angle. The direction here changes here, and it runs forwards, downwards and medially, and by piercing the buccopharyngeal fascia and pharyngobasilar fascia and the sinus of Morgagni, it opens into the lateral wall of the nasopharynx. So that's about the opening of the cartilaginous part of auditory tube. Coming to the relations of the cartilaginous part of auditory tube. Coming to the above relations, we have spine of the sphenoid. Anterolateral relations, we have spine of the sphenoid. So I am coming to the relations of the cartilaginous part of the auditory tube. Above relations, the anterolateral relations, we have spine of the sphenoid is here. We know that spine of the sphenoid, here it is situated here. Here is the spine of the sphenoid is here, spine of the sphenoid, and it is also related to tensor villi palatine muscle. It is also related to tensor villi palatine muscle. It is also related to tensor. Here is the tensor villi palatine muscle. It is also related to tensor villi palatine muscle, and this muscle separates the tube from mandibular nerve and its branches, otic ganglion, and also middle meningeal artery. It separates this tensor palatine muscle. It separates the tube from all these structures: mandibular nerve and its branches, otic ganglion, and also middle meningeal artery. So anterolaterally it is related to the petrous part of temporal bone. Anterolaterally it is related to the petrous part of temporal bone, and it is also related to the tensor villi palatine muscle, or we can call it as tensor palatine muscle, which separates the tube from the following structures, that is mandibular nerve and its branches. We know that mandibular nerve here emerges from the foramen oval here. So mandibular nerve and its branches, middle meningeal artery is here, chorda tympani nerve is here. So it separates all these structures. Tensor palatine muscle separates all these structures, otic ganglion. So these are the structures related to the anterolateral part. Coming to the Posteromedially it is related to the apex of the petrous part of temporal bone. Here is the apex of the petrous part of temporal bone, levator villi palatine muscle, apex of the petrous part of temporal bone, and also levator villi palatine muscle. And above we have sulcus tubae. We know that auditory tube, the cartilaginous part of auditory tube lies in the sulcus tubae, a bony partition between the greater wing of sphenoid and the pinna petrous part of temporal bone. It is nothing but an articulation between the greater wing of sphenoid and the petrous part of temporal bone. We know that this one is the sulcus tubae is here. Sulcus tubae, it is a articulation between the greater wing of sphenoid and also articulation, the green color one, we call it as sulcus tubae, greater wing of sphenoid. This is the green color one, where the cartilaginous part of auditory tube lies. This is the cartilaginous part of auditory tube lies. It is about 24 mm in diameter, 24 mm in length. So sulcus tubae, above we have sulcus tubae, and below we have medial pterygoid plate is present, and below we have medial pterygoid plate, superior constrictor muscle is present, medial pterygoid plate, and also pterygoid plate hamillus is seen, medial pterygoid plate, pterygoid hamillus, and also processus tuberosus is seen. Processus tuberosus is nothing but the bony projection from the medial pterygoid plate, and also a few fibers of the tensor palati. They also forms the below relations of the cartilaginous part of auditory tube. So coming to the cartilaginous part of auditory tube, they have anterolateral relations and posteromedial relations. Anterolateral relations are the spine of the sphenoid and also tensor villi palatine muscle. They are the anterolateral relations, tensor villi palatine muscle and also spine of the sphenoid. And the tensor villi palatine muscle, it separates the tube from mandibular nerve and its branches, otic ganglion and its connections, and chordae tympani nerve and middle meningeal artery. And coming to the posteromedial relations is related to the apex of the petrous part of temporal bone and also levator villi palatine muscle. This is the levator villi palatine muscle. Levator villi palatine muscle and the apex of the petrous part of temporal bone. And coming to the above relations, we have sulcus tubae. We know that sulcus tubae, with the way the cartilaginous part of auditory tube lies in the sulcus tubae, which is an articulation between the greatest wing of sphenoid and the petrous part of temporal bone. Here we have sulcus tubae. Is here, and below we have medial pterygoid plate is here, medial pterygoid plate. So this is the medial pterygoid plate is here, and from the medial pterygoid plate we have a projection called pterygoid processus tuberosus is present, superior constrictor muscle is present, and also a few fibers of the tensor palati and also salpingopharyngeus. They form the below relations of the auditory tube. And coming to the nerve supply of the auditory tube. The nerve supply of the auditory tube, the entire part of the auditory tube, it is supplied by the glossopharyngeal nerve except the pharyngeal end. It is supplied by the pharyngeal branch from the pterygopalatine ganglion. The entire part of the auditory tube, it is supplied by the glossopharyngeal nerve. And coming to the arterial supply of the auditory tube. Coming to the arterial supply, it is supplied by the greater palatine artery and also it is supplied by the ascending pharyngeal artery, and it also supplied by the artery of the pterygoid canal. And here are these are the arterial supply of the auditory tube. It is supplied by the ascending pharyngeal artery, artery of the pterygoid canal, and greater palatine artery. These are supplied the auditory tube. And coming to the veins plexus is drain into pterygoid plexus of veins drain into pterygoid plexus of veins, and lymphatics drains into deep cervical loop of lymph nodes. This is about the auditory tube. So auditory tube consists of osseous part and cartilaginous part. Osseous part, it is about only 12 mm and cartilaginous part is 24 mm. Osseous part starts from the anterior end of the tympanic membrane, and this auditory tube opens into the lateral wall of the nasopharynx by coming downwards, forwards and medially by piercing the buccopharyngeal fascia and the pharyngobasilar fascia and the sinus of Morgani. It opens into the lateral wall of the nasopharynx, where it is covered by an elevation called tubal elevation. And this bony part, it is narrower by opening into the cartilaginous part. This narrowing part we call it as isthmus, and from the isthmus the cartilaginous part starts. And coming to the relations of the bony part, above we have tensor tympani, below we have tympanic plate, below we have tympanic plate of temporal bone, and this is the tympanic plate of temporal bone. Here is the tympanic plate of temporal bone, and above and medially we have carotid canal, and laterally we have a tegmentum. Coming to the relations of the cartilaginous part, we have above we have spine of the sphenoid is present. Above we have spine of the sphenoid, and also it is related to the tensor palatine muscle, and it is also related to the mandibular nerve and its branches, because foramen oval it is needed here, so it is related to the mandibular nerve and its branches, otic ganglion and its connections, and also chorda tympani nerve, which is a branch from the facial nerve, it is also related to here, and also middle meningeal artery, which is a branch from the maxillary artery. And coming to the below relations, anterolateral relations, and coming to the posteromedial relations, it is related to the levator villi palatine and apex of the petrous part of temporal bone. Above we have sulcus tubae, below we have superior constrictor, a few fibers of the tensor villi palatine, and also salpingopharyngeus muscle, pterygoid hamulus, and also processus tuberosus. This coming the inferior relations of the auditory tube. So auditory tube, it helps in the proper vibrations of the sounds. It helps in proper vibration of the sounds by maintaining the equilibrium of the air pressure of the tympanic membrane. So that's about the auditory tube or eustachian tube or pharyngotympanic tube.